So one of the questions I'm commonly asked is, what can a rhinoplasty do for me? What's a rhinoplasty? Can it help? There are a number of different ways a rhinoplasty can help. A rhinoplasty is basically operating on the nose, and it's one of the most common plastic surgery procedures that we do. And in terms of the most common reason that patients will come to me is they've had a lifelong issue in terms of self-confidence in how they feel about their nose. Some patients have even been bullied at school, but sometimes it's just that self-confidence. It's something that's bothered you for a long time. The most classic thing is a hump, and it's the Romanesque type nose where there's a prominence along the nasal bridge that gives a more harsher, stronger looking nose that looks fine on a bloke, but often on a lady it can be just something that looks a bit harsher and makes just someone feel less confident, and especially in this day and age where we're doing selfies, and it's a selfie culture of taking photographs is such a huge part of everyone's life now. It's something that these factors can affect how we feel about ourselves and how confident we look, and it's something that can be addressed. So a hump is a classic thing. The tip of the nose, sometimes a tip can have a bit of a droop to the nose, or it can be a bit rounded and a bit full, so-called bulbous nose. So a droopy tip, a bulbous nose, a very wide or flared nose, a prominent hump, a wide bridge here, deviation of the nose, and that's something that's quite a common thing that patients complain of, where the nose is, because the septum's deviated, the nose can be tilted and deviated one way or the other. This can often happen just naturally. It's the way we're made. We can blame our parents for it, or it's something can happen as a result of trauma from a knock in childhood or in adolescence or whenever, where trauma, an injury to the nose, can cause the septum to become fractured and dislocated. And these are all things that can be addressed by a rhinoplasty or a rhinoseptoplasty. It can be performed in a number of different ways. There is basically two main types of rhinoplasty. There's an open or a closed. What's the difference? Well, the difference is how we approach the nose and how we make access to deal with the nose. A closed rhinoplasty is a rhinoplasty which is done essentially just through the nostrils. So where a surgeon, we will go in through the nostrils without making an incision here. When's a closed rhinoplasty a good option? A closed rhinoplasty is a great option for some patients where it's more of an isolated issue with a hump on the nose, where the tip is fine, happy with the tip, there's no major issues there, and it's really just that there's a hump that makes the nose just look harsh. It gives that bump on profile, essentially. And this is something that's very amenable to being improved by a closed rhinoplasty, where we go in through the nostrils, we tip the bump down, bring the bones in, support the inner aspect of the nose. And sometimes we can do a little bit of minor adjustments to a tip, and this can be done quite comfortably through a closed rhinoplasty. However, if there are more issues, particularly with the tip of the nose as well, which is more often than not the case, where there's flaring of the nostrils, there's a wide tip, there's tip asymmetry, there's a very bulbous type nose, where we need to really get a much more accurate look to the tip of the nose, a more defined look to the tip of the nose. And it's much more, in my hands certainly, it's much more appropriate to do this through an open rhinoplasty. So what's an open rhinoplasty? How does it differ? Well, essentially it differs by, there's an incision that just goes across the narrow part of this bit of the nose here, which is called the columella. So it's a small incision that's done through here, which allows the skin to be lifted and allows direct access. I always say to my patients, it's almost like with a closed rhinoplasty, you're operating through a letterbox into a room, whereas with an open rhinoplasty, you're opening the door, and it gives much more access to the nose. I've done a program for the BBC, and that sort of demonstrates that, and that's available on our YouTube page. And so you can go on to the Elite Surgical YouTube page and have a look it's an hour long, just technically showing all the various stages of a rhinoplasty. And it's not for everyone to watch. It'll put some people off, but I think it's actually quite a vivid and accurate description and illustration of what's involved in rhinoplasty. Now, with the open approach, by lifting the skin, accessing the nose, the hump can be taken down. The side walls of the nose here can be reinforced and supported to prevent problems happening down the line, such as what's called an inverted V deformity. And then the tip cartilages can also be adjusted, and they can be made narrower. So the tip of the nose, often when it's a rounded nose, a so-called bulbous nose. A bulbous nose is quite, almost the tip cartilage is almost like a U shape at the end, so they have that rounded look to them, and they can often be quite full here. So it has that rounded look there, fullness there. And what we can do is with accurate tip reshaping, we can make the tip much more of a V shape, and much more of a dainty and more defined tip. So this is what the essential differences are with an open versus a closed. Obviously, with either technique, you can also adjust a deviated septum, but in my opinion, it's much more accurate to be able to do that through an open approach, because it's there in front of you, and we can reshape the septum, align the septum, fix the septum in a more central position. And then the other part of a rhinoplasty is often patients will complain that the nostrils are a bit flared or a bit wide or a bit long. And again, nostrils can be adjusted as part of a rhinoplasty by doing what's called an Adler base reduction. That's a little incision that's made in the crease of the nostrils to reduce the flaring of the nostril. Overall, rhinoplasty can have a dramatic impact on how someone feels in terms of their own self-confidence, and how they just their natural ability to communicate with other people. They just feel much more comfortable in their own skin. Something that's been an issue for them for most of their lives now becomes a non-issue. One of the big things that patients say is they're very worried about it's going to make too much of a difference. Too much of a difference. Oh my God, if I have a rhinoplasty, it's going to make too much of a change. Everyone's going to realise. I think a good rhinoplasty is that type of surgery where if someone that you know that you haven't told about a rhinoplasty, they see you and it's almost like double take, where they look at you again and they think something's different. Something's different. And they can't actually put their finger on it. And people say, no, of course, that's not going to be the case. But you'll be surprised. Patients are often surprised that often even their nearest and dearest initially can't work out exactly what the difference is. And I think this is a sign of good surgery. It's just that it's where it's the smaller version, or the more ideal version of the nose that you've always wanted is there. So it's still your nose, but it's just a more refined version of your nose. So this is a rhinoplasty, and I think it's a fantastic type of procedure that can really help improve patients' self-confidence and their feelings of well-being. It's something that I do a lot of, and not done by many surgeons, not many plastic surgeons. Many plastic surgeons don't do rhinoplasties. It is important to be realistic, and this is vital. This is something that's in the middle of your face. It's not something you can hide under clothing, and so it's important that for any patient, you're aware that there are risks and complications with any kind of procedure. And so it's important to make sure that you understand these and you're aware of these, and you go to a surgeon who you feel can address problems if problems were to arise. Because with surgery is not an exact science. No one can actually guarantee a particular outcome. Results can be quite unpredictable. You can do a very similar operation of two patients, very similar, and they end up with a very different result, because many factors can affect how someone heals from surgery. Thickness of your skin, just genetic factors, environmental factors, people that smoke, a lifestyle, many things can change and can affect the ultimate result that you have from surgery. So it's important to be realistic, and if you're realistic and you understand the risks, understand the potential benefits, it's about weighing up risks versus benefit for this type of surgery to try and achieve a good outcome from it. And if a patient's expectations are realistic, then generally patients will have an excellent outcome and an excellent journey through rhinoplasty. And often patients will say, I don't know why I didn't do it years ago. I'm often asked, is surgery the only answer for a rhinoplasty to change my nose? There are other options to help improve the aesthetics of how a nose can look. And the main thing is what's called so-called non-surgical rhinoplasty. Non-surgical rhinoplasty essentially means using dermal fillers, and dermal fillers are the things that are very popular out there. They do have their own risks and potential complications, so it's important to be aware of that. It's important to make sure that any practitioner that's offering this service is fully trained and able to deal with the potential complications of fillers. But what non-surgical rhinoplasty involves is injecting dermal filler. And if you imagine there's a bump here, there's a bump there, then what we can do is we can inject a little bit of filler above and a bit of filler below to disguise a bump. to make it look less of a bump, more of a straighter profile. We can use a little bit of filler very carefully, and I stress it needs to be done very carefully, because occluding a blood vessel in the nose is a disaster. And this is something that needs to be avoided. And this is where having a practitioner who's, a medical practitioner who's aware of the anatomy of the nose, and as I said earlier, is able to deal with the potential complications. So we can use filler here to help lift the tip fractionally, and filler above and below a bump to disguise a hump. With any kind of non-surgical rhinoplasty, there are significant limitations and things to be aware of. And the limitations are, obviously, if there's a significant bump that's here, whilst it can be reduced in appearance or disguised, the dorsum of the nose, it ends up, by filling this area here, it needs to generally be more filled in between here, in this little area called the radix or the nasio, this area here. So this becomes fuller. And the overall, the filler that's in the nose generally can make the nose look a little bit bigger, It's filler, it's dermal filler, it's adding volume. But it's about improving the aesthetics. But for the right patient, for a small issue, a small hump, etc., it can be a nice initial way to see if a patient likes the effects of reducing or removing a hump, but ultimately it is no replacement for a definitive rhinoplasty. A filler will generally last between anything from 6 months to 18 months in duration, then it will need to be repeated, and this will be lifelong being repeated. Whereas with a surgical rhinoplasty, this is for life, it's permanent, and it's something that whilst there is something called revision surgery, where we can go back inside and rebuild the nose if there's been a complication or a problem with the nose, or if a nose has been very traumatized, and we can rebuild a nose using a patient's natural tissues, using ear cartilage or using rib cartilage grafting to reconstruct a damaged or problem nose that suffered significant complications from earlier surgery, etc. This is rare, and it should be rare. But certainly this is something to be, for all patients to be aware of. So non-surgical rhinoplasty is certainly one way of changing the aesthetics of one's nose. But it's a poor distant relation to a surgical rhinoplasty, which is a permanent solution to a nose. What are the complications of rhinoplasty? I'm often asked, well, there are, like any surgical procedure, there are general and specific complications with a rhinoplasty. General complications with any surgery are the complications of whenever you go to sleep, because this is a general anesthetic procedure, normally done as a day case. These days it's done as a day case. And this means the patient will have the surgery and be able to go home the same day. Often with packs in the nose, either dissolvable packs in the nose or packs that get removed after 24 hours. Generally now I use dissolvable packs. I think patients often used to find, when I was using packs that need to be removed, they would find that probably the most uncomfortable part of the whole procedure, the whole journey. So I've switched now to using dissolvable packs, and patients generally tolerate this much better. They dissolve after about 7 to 10 days. There'll be stitches with an open rhinoplasty, stitches that need to be removed, and these are removed after 7 days. And I have a splint on my patients' noses, and that splint stays in place for 2 weeks. Used to be a week, 2 weeks, much better. Helps to keep that swelling down at a minimal level, and just allows things to knit together a little bit more before the splint is removed. So more general complications are everything from a general anesthetic point of view. More specific complications with the nose are things such as residual asymmetry. No one can guarantee it perfectly straight. If you have a very crooked nose, it's almost nigh on impossible to guarantee a straight nose. And I certainly never guarantee that to my patients. There is always that risk of residual deviation. It's very akin to when you straighten a wonky septum, a wonky piece of cartilage, a crooked piece of cartilage. Cartilage has memory, just like teeth have memory. And I always use the analogy, imagine when you have teeth moved with braces. If you don't wear a retainer or a fixed wire afterwards, they will tend to drift back to some extent. It's very similar to the septal cartilage. The septal cartilage will tend to drift back to some extent, hopefully never to the same extent as it was before surgery. So hopefully there will always be that improvement, but there's always that risk of residual deviation of the nose. But swelling, bruising, pain, infection, bleeding. These are sort of early complications that can happen. Bruising for a couple of weeks, 2 or 3 weeks after surgery. Infection is a very low risk with rhinoplasty surgery. Sometimes there can be very superficial infections just around the sutures, because some of the internal dissolving sutures can take a bit longer to dissolve and cause the odd little stitch abscess, but it's not a major issue. It can be dealt with very effectively. Swelling is one of the big things with surgery, with terms of rhinoplasty. With swelling, is particularly problematic, or can be problematic, for patients with very thick skin, very thick, oily skin. Patients with thick skin generally will have swollen tissues for a lot longer. I say a rhinoplasty is not like a short sprint, like a 60-meter dash. It's like a marathon. It's going to take time, and it can take anything up to a couple of years really before the final results of rhinoplasty really manifest. I mean, you'll see pretty much a result, and quite a significant result, literally when the splint is removed. But 80% of the swelling normally settles by about 6 to 8 weeks. It's that residual 20% that will take time for it to slowly to go down. And things that you eat, things that you do can affect how much swelling there is in the nose. So swelling, residual deviation, these are sort of classic things with any nose. Residual tip droop, or columella that can hang. This can happen after surgery. Taking away and not supporting the bridge of the nose can cause little divots to form here, which is called an inverted V deformity. And that's what I do for my patients, is I'd rather than removing tissues here when I'm reducing a hump, I'll fold tissues in on themselves and re-stitch them to the septum, call them an auto-spreader graft. And this is one of those things that can help reduce the risks of inverted V deformity. Many things that I do when I'm doing my surgery are done to try and prevent a potential complication happening. Because I think if you do these things, it can reduce that risk of a complication happening in the future, to give the patient a very stable, predictable, much more predictable result from their rhinoplasty surgery. I always say to my patients, they will not leave my theatre table until I've got them as good as I can get them. And I think rhinoplasty is relatively straightforward. Some people say it's the most complex cosmetic surgery procedure we do. I find it relatively straightforward. And that's the trick, is that it needs to look good at the end of the operation. If it doesn't look good and feel good at the end of the surgery, when the patient's on the table, it never will. It never will. And so it's just about that attention to detail, which really will change what's a reasonable result into a great result.